This webinar of the European Medical Association, March 31, 2021, is hosted by MEET, is free and open to all health professionals. Its aim is to investigate which agreement is currently present regarding few topics and controversies on the proposal of delivering a health passport for allowing free circulation of European citizens in Europe without restrictions, delays or quarantine periods. We briefly detail some preliminary result of the ongoing survey, including few graphics, included in this summary report of the workshop Health and Vaccine Strategy. The EU Commission proposed and is developing a Green Pass, which includes a certified COVID-19 vaccine history, COVID-19 serology, if any, and the declaration of recovery from a COVID-19 disease. This with the concept that such citizens are minimally or very not infectious and minimally suitable to get a COVID-19 contagion or disease. The key question is, a vaccine passport will help the EU state members and citizens for safely returning to traveling, dining out, attending live sporting events, going to music concerts, etc. Most answers are quite favorable to this proposal. The second most important question is, a vaccine passport will help the EU state members and citizens for safely returning to traveling, dining out, attending live sporting events, going to music concerts, etc. Most interviewed think that yes, this is a good solution for the current problems of mobility. There is some doubt about the safety for transparency and privacy of the use of this Green Pass. Do you think that such rules and passes are a menace for data privacy, and do you have any ethical concern? The answers are not univocal.
A core point is that in most countries and towns, when vaccinated, each person is receiving a comprehensive QR code certification. This is what our interviewed know. And in other answers they think that this should be enough, without the need of any special pass, also considering that already an international certificate of vaccination exists, that could be implemented with the COVID-19 vaccination add-on. Our interviewed were mostly medical doctors. All the age range is reasonably represented by our interviewed.